Nursing migration is a concept which outlines the movement of nurses from their home country to foreign countries. This movement is often influenced by numerous factors, including working conditions, healthcare systems, economic opportunities, and work life balance. Currently, the rate at which registered nurses are departing their home country has increased exponentially, with 13 to 37% of registered nurses worldwide working in foreign countries compared to 5% in the 1970s. A country which is directly involved in the increase of nursing migration is Germany, where foreign employment of nurses has increased by 11% in the last 10 years. This presentation will include an overview of nursing migration within Germany, with a specific emphasis on elements relating to migration, including push and pull factors, impacts on involved countries, and regulatory considerations. Within nursing migration, the concept of push factors focuses on elements that influence an individual to leave their home country and seek employment in countries like Germany. Currently, India and the Philippines have some of the highest nurse export numbers per capita due to a combination of push factors including low salaries, job security, and working conditions. Within the Philippines, many nurses experience uncertainty in job security, with short-term and contractual employment being common. Even those with stable contracts, underemployment is a common occurrence, with many nurses working in roles below their current qualification level. Correspondingly, the same issues are seen within the Indian nursing sector, with nurses facing poor working conditions, outdated healthcare technology, and low salaries. These issues were further exacerbated within the COVID-19 pandemic, which saw nurses being overworked with insufficient hospital resources. The combination of these push factors further influenced nurses from these countries in their decision to migrate. Alongside factors pushing nurses from their home nation, there are also factors which draw nurses to countries like Germany. To attract overseas nurses, the German government has numerous incentives in place, including salaries of roughly 8 to 10 times higher than that of the Indian and Philippines national average. Coupled with increased salaries, nurses who migrate can also have opportunities in career advancement, with incentives such as free university for foreign nurses wanting to complete postgraduate programs to further their skill set. This has also been promoted by recent legislation changes, which have strengthened nursing studies and simplified the criteria for recognizing foreign nurses' accreditations, further facilitating career recognition and advancements for nurses working within Germany. Moreover, working conditions within the German nursing sector also commonly held at a good standard, which allows nurses to work in stable practice settings, having access to new and updated healthcare equipment, which aid them in delivering competent care. The process of nursing migration can impact both source and destination countries through economic, healthcare, and social influences. Within source countries with high nurse export rates, like the Philippines, the volume of nurses leaving the workforce to find overseas employment have led to deficits in the number of experienced staff members who choose to remain in the country. The number of nurses who gained qualification in the Philippines who are now working overseas continue to increase, with a 2021 study by Lorenzo and Lakima showing roughly 30% of Filipino-trained nurses are currently working outside of the country. This depletion of skilled staff can often lead to the deliverance of care being compromised, as remaining staff are often left to compensate for reduced worker levels, causing burnout and fatigue. Furthermore, the concept of brain drain is also frequently referenced in relation to nursing migration, as it assesses the impacts of migration on nursing proficiency within a country. This is further supported by a survey conducted by Nichols in 2016, which found 46% of Indian nurses with over 5 years of experience intended to work overseas in the future. This reduction in senior staffing levels then causes younger and less experienced nurses to work within a much broader scope of practice in a shorter period of time. This can then impact overall care and lead to increased likelihood of errors. In contrast, These negative effects on the Indian and Filipino healthcare system are commonly overshadowed by the economic benefits gained through nursing migration, such as salary remittances. As nurses working in the German healthcare sector have the opportunity to earn over 10 times the salary offered in their home country, many decide to send significant portions of their income to family members still living in their home country. This financial influx can then fund education, home payments, and increase overall household income. Within the Philippines, the remittances sent home by nurses working overseas equates to $8 billion annually, showing the significant role nursing migration plays within the country's economy. Coupled with the effect on source countries, destination countries like Germany also experience a range of impacts due to nursing migration. Germany's current aging population has led to issues such as an increased number of citizens requiring medical assistance, heightened medical costs, and economic challenges. The combination of these factors have put strain on nurses and the overall healthcare system. Coupled with the strain on current staff, it is estimated that Germany will need an additional 280 to 690,000 nurses by 2049 to meet healthcare demands. Through government incentivized programs recruiting overseas nurses, the strain and pressure placed on current staff can be alleviated as target employment numbers can be met, resulting in the ability to deliver the required care to the aging German population with a lower nurse-to-patient ratio. Contrary to the benefits the German healthcare sector gains from nursing migration, the assimilation of foreign nurses requires significant investments in areas such as language proficiency, where the government either funds or subsidizes German language courses in foreign nurses' home country. The participation in these courses are vital to ensure nurses hold the required communication skills to converse with both other staff and patients. For overseas nurses applying to work in Germany, the current licensing process to gain registration takes roughly 6 to 12 months in total. Within the application process, the credentials and experience of each nurse is assessed and compared to German regulation standards. If the qualifications of these nurses do not match the required criteria, they will most likely have to undertake a competency test to assess their current knowledge base or complete an adaptation course before gaining registration. Alongside the admission process, ethical concerns relating to registration and practice can also arise, with many migrating nurses reporting they have faced cultural bias based on their background. The presence of these biases were further instated through a 2020 study conducted by Mollwitz, which found 44% of surveyed migrant nurses reported being subjected to discrimination whilst working in the German healthcare sector. From this, it is evident that policy improvements need to be made in order to ensure integration of foreign nurses is supported and equality within the German nursing sector is established. The concept of nursing migration involves the migration of nurses from source countries, including India and the Philippines, to destination countries like Germany. This movement is influenced by factors pushing nurses from their home country, like poor working conditions and low wages, and pull factors such as increased salaries and career advancement opportunities. Germany's demand of foreign nurses has been supported by government-based incentives and has positively impacted their workforce shortages. While source countries still face problems like brain drain and staff retention issues, they benefit economically through remittances sent home by nurses working overseas. Through migration, Germany gains skilled staff but are required to invest in integration methods such as language and health literacy training programs. Overall, the concept of nursing migration encompasses positive and negative factors for both countries involved, but changes in German healthcare policy need to be made to ensure equality standards are met.